Hello everyone, welcome. Thank you all very much for coming. It's my pleasure to welcome you to our webinar series, What to Expect, a Guide to Prostate Cancer. So my name is Kath Coleman and I'm the Research Communications Officer at Prostate Cancer Research. So sadly, David isn't able to join us today, but I'll be taking his place and I'm very excited to be with you all this evening. So this webinar series is a collaborative project between ourselves and the pharmaceutical company Ipsen. And today we have the third of our webinars in this series. And today's webinar is called What's Next After a Prostate Cancer Diagnosis? Reviewing the options and making decisions. So today we have two wonderful speakers, clinical nurse specialist Louisa Fleure and psychologist Dr. Sue Smith. So Louisa unfortunately can't be with us live today, but she has sent in her presentation via video. So I'll let them both introduce themselves in more detail during their presentations. But a big thank you to both of them for joining today's webinar. So as I mentioned, this webinar is the third of an 8-part series. So today we'll be diving into the different management and treatment options of prostate cancer and offering advice on how to look after yourself following a diagnosis. Then next week in webinar 4, we'll look at the monitoring and treatment options available for early stage and high risk localized prostate cancer, including active surveillance, focal therapy, and hormone therapy. Then the following week in webinar 5, we'll be talking about radiotherapy and surgery, the side effects associated with each treatment, and the long-term outlook. Then webinars 6 and 7 will discuss metastatic prostate cancer and how it is treated, whilst webinar 8 is focused on end-of-life care. So for more information on all of our webinars, please do visit our website, pcr.org.uk/what-to-expect. So there you'll be able to find out more information about all the episodes, including who will be speaking in each session, as well as how to watch previous webinars on demand. So then for the purposes of today's presentation and for simplicity, we've used the term men throughout, but this should be considered to include not only men, but also trans women, non-binary people who were assigned male at birth, and some intersex people, as they are also affected by prostate cancer. So it's now my pleasure to hand over to our first speaker, Louisa.
Hello, my name's Louisa and I am a clinical nurse specialist at Guy's and St Thomas's Hospital in London. And welcome to this webinar. This is webinar 3 in a series of 8. And we're going to talk to you about what happens after a prostate cancer diagnosis. This is going to include some of the ways you might feel, some of the decisions you might have to make, and most importantly, how we can support you to make the decision that's right for you. So I think a really good place to start is to just take some time to acknowledge how it might feel for you to actually get a prostate cancer diagnosis. We all react to these things very differently, but some of the things you might be feeling is you might feel scared, you might feel worried, you might feel stressed or angry. There's many, many different ways that a prostate cancer diagnosis may affect you. Alongside that, there's an awful lot of things to think about. We might be asking you to think about treatments, we might be asking you to think about plans of care, and there are lots of things that are going to contribute to the decisions you make. Some of the things we might be asking you to think about is the stage and the grade of your cancer, and we'll talk a little bit more about what that means. We're almost certainly going to be talking to you about treatments to manage your cancer, and there may be a choice to make about the treatments. And hopefully we'll also be considering your wants and your needs in terms of your cancer treatment and your cancer journey. What's absolutely essential is that each man is treated as an individual and that we help you make the decisions about the next steps in conjunction with you and your loved ones. So nowadays, the management of prostate cancer often involves choices, and it's focused on the individual. It's really important that we see you as an individual person with your own particular background and wants and needs, and we take account of those preferences. In prostate cancer, there are many treatments that we have on offer, and you may be offered a choice of treatments. Your doctor or your specialist nurse will explain your treatment options to you and help you choose the thing that's right for you. So when you're talking about treatment options for prostate cancer, a lot of these treatment options are based on the stage of your cancer. And what stage means is where the cancer is and how quickly it's growing. We describe this in a variety of ways. It might be using what we call the T system. T stands for tumour, and that literally is just a description of where the prostate cancer is. You might hear it called localised, locally advanced, advanced, and again, this is just a different way of articulating that. So let's have a look. You can see some pictures on the screen. So if your prostate cancer has been diagnosed and it's still completely inside the prostate, we'll call that localised, and you may also hear it called T1 or T2. If your prostate cancer has just breached the capsule, which is the surrounding membrane of the prostate, and it's just poking through that, either just outside or into the seminal vesicles, which are the little sacs above the prostate, we'll call that locally advanced or T3. If your prostate cancer is spread from the prostate into other parts of your body, away from the prostate and the nodes, the lymph nodes immediate around the prostate, we might call that advanced or metastatic. And this information is really important because what treatments are available to you will depend on where your prostate cancer is. So if you're not sure about that, please do go back to your healthcare team and just confirm and clarify what they know about your particular cancer. So there are lots of things to bear in mind when you're thinking about treatments. One is obviously the treatments you've been offered. As I said, that will be based on how far your cancer is spread. But it's really important to understand what each of these treatments involves. That's not just the logistics of the treatment, exactly what's going to happen, but it can be things like practicalities. Will I have to travel? Is it a day case? Will I be in and out? Will I need a course of treatment? Will I need hormone treatment? Will I need to come up to the hospital every day? All those things are really important, particularly if you're still working or you're self-employed. Your general health is another really important thing to think about. Lots of us come to a cancer diagnosis with other health conditions, and some of those conditions may impact your response to treatment. It's also really important to know how quickly your cancer is growing. And we do that by looking at what we call the Gleason score. And that's, you will have heard about that in previous webinars, but basically it's a way that we can categorize the cancer to give us an indication of the potential of how quickly it might grow. If you've got a low risk or an intermediate risk prostate cancer, so a Gleason 6 or 7, we often feel that you've probably got a little bit of time to decide what you want to do. But if you've got a higher grade cancer, we might be asking you to really think about your decisions sooner rather than later. How long you're expected to live is often a really difficult thing to think about. And you may wonder why on earth we're asking you that. But prostate cancer is often quite a slow growing cancer. So life expectancy is actually really important. Lots of studies have shown that if you've got an early prostate cancer, the time it takes to become something that's more significant to your health can be up to 10 years. So if you're significantly older, for example, or you've got any life-limiting conditions, it's really important to think about that, and you don't undergo treatment that might affect your quality of life in the short term, where actually it may not be needed. The advantages and disadvantages of treatment are really important. Everything in life has a pro and a con, and we need to weigh it up. So sometimes I think in the kind of panic and the confusion of diagnosis, it can be almost obvious that you want to sort of rush to a treatment and sort of crack on with things really quickly. But actually, it's really important to sit back and think about what the treatments can give you and what it's going to cost you in terms of side effects, etc. How you feel about different treatments is another really interesting one. Again, lots of us come into a situation like this with life experience. You may have relatives that have had prostate cancer or other cancers. You may have experienced surgery before or radiotherapy before. You may have loved ones that have experienced it. So again, it's really important to talk about that. Tell us your experiences so we can discuss it with you and see whether that is something that is going to be important for your feelings about your treatments going forward. And last but not least, possible side effects. Again, I think in the kind of confusion and the immediacy of a diagnosis, sometimes it can feel as if side effects aren't important. Many people that we talk to feel that the most important thing is to get rid of the cancer as quickly as possible. And later down the line, those side effects may actually end up being really important to you. I think the take-home message is your decision needs to be something that's going to improve your outlook, both in terms of survival, obviously, but also in terms of quality of life. So let's look at those different stages of cancer, because, as I said to you before, the stage of your cancer actually really influences what treatments are available. So we said that localised cancer hasn't spread to any other parts of the body. It's completely confined within the prostate. Now, localised prostate that's caught early tends to grow slowly and sometimes not at all. So whilst the kind of natural reaction to a cancer diagnosis is I need treatment, some prostate cancers actually don't need treatment. And this is a crazy kind of concept to get hold of. But this information is based on a huge amount of research. If you've got a very low grade, so a slow growing cancer that's completely localised, it's caught early, some men will never need treatment for that. And never needing treatment means that you can avoid any side effects of treatment. If you're fit with a good life expectancy, etc., you'd probably be discussing what we call active surveillance, and that is a form of monitoring. So in active surveillance, we don't rush into any what we call radical treatments. That would be something like surgery or radiotherapy. We actually monitor the cancer almost to see what's going to happen to it. And the way we do that is we use MRI scans to look at the prostate, and MRI techniques have come along leaps and bounds in the past few years, and they're actually very accurate in terms of us looking at the prostate cancer over time to see whether it's getting any bigger. You'd have repeat biopsies every kind of 12 to 18 months, again, just to make sure that the cancer's not changing. And over time, we can give you some really accurate information about whether your cancer is stable and doesn't need any treatment, or whether actually it does need treatment. You might also heard of something called watchful waiting, and those two terms used to be used interchangeably, but they're actually very different. For watchful waiting is more of a hands-off approach. We use watchful waiting if you have got prostate cancer that's localised, but you probably aren't fit, or even you don't want radical treatment like surgery and radiotherapy. And for watchful waiting, we monitor you with PSA blood tests. So we look at your prostate-specific antigen, and we defer any treatment, which is traditionally hormone therapy, until the cancer starts to spread. And that may seem absolutely crazy, but the reason we do it is because, again, lots of prostate cancer won't cause any problems for the future. So by monitoring your PSA and doing scans when necessary, we can defer any treatment that might cause you side effects until it becomes a problem. But if you do need treatment, or you do choose treatment, then we've got a number of options. And sometimes it feels that we're in a great position having choices, because it means that we can tailor the treatment to the person. But I know from experience that in reality, this can be quite difficult, because when you've just had a diagnosis, being asked to choose between treatment A and treatment B when you're not a medic, and even if you are a medic, to be honest, can be really difficult. I think the most important thing to say is that there is no right treatment. There's only a right treatment for you. So that when we discuss these treatments, we will probably tell you that there isn't any real benefit in terms of the success. Often, if there is, we'll let you know. But it's really about what the treatment means to you and what the right thing is for your life and your lifestyle, for you and your loved ones. So we're going to talk about all these treatments in more detail in subsequent webinars, but surgery is basically the complete removal of the prostate. The benefits is you're in and out usually in a day or two, and then after a period of recovery, life pretty much goes back to normal, although there are side effects, which we'll talk about later and in subsequent webinars. External beam radiotherapy is basically radiotherapy, so high focused, high energy X-ray, which are focused towards a prostate, and this is usually done over a period of anything between 4 and 6 weeks, and it's often or usually combined with a period of hormone therapy as well. So it's a longer treatment, but there's no surgery involved. But again, there are side effects. Brachytherapy is different. It's another form of radiotherapy, but it's what we call internal radiotherapy. So either seeds or rods are inserted into the prostate and they emit radiotherapy beams, which then kill the cancer. Again, it's a day case, but there are some pros and cons in terms of side effects for that as well. And it's not suitable for all prostate cancers. And then there are some less common treatment options, and often these are only in certain centres because they're usually offered in terms of sort of studies or trials, although they've all been around for a long time, and we call those focal therapies. If your prostate cancer is locally advanced, and you'll remember that means it's just starting to broach the capsule or the covering of the prostate, again, your treatment options, we are still aiming to cure you, to get rid of the cancer, but sometimes our aim might be to actually keep it under control, rather than get rid of it altogether. When it's completely localised, our aim is very much to get rid of it completely. I often put it in context that if you have treatment for locally advanced prostate cancer, we absolutely want to get rid of it, but sometimes it's about just knocking it back. So we can treat it, we can put it into almost like a kind of a remission, but it may be that you need further treatment in the future. And again, the types of treatment will depend on how far the cancer's spread. You've still got the option of watchful waiting, that's always on the table. If you feel that right now treatment is not the right time for treatment, then monitoring, keeping you under review and keeping the options on the table is still always going to be there for you. But if you do want treatment, and treatment is advised, again, we might be thinking about external beam radiotherapy with hormone therapy, and maybe that combined with brachytherapy. So a sort of combination external and internal radiotherapy treatment with hormone therapy. We might be talking about just hormone therapy, which will keep things under control but won't get rid of it. Or we might be thinking about another combination of surgery, perhaps often followed by radiotherapy. For prostate cancer that's spread from the prostate into other parts of the body, for example, the bones or perhaps lymph nodes away from the prostate, we call this advanced prostate cancer or metastatic prostate cancer, or sometimes METS, lots of sort of different terminology there. Unfortunately, if the prostate cancer is spread away from the prostate, then we can't get rid of it altogether. But what we do have is sequences of treatments which can keep it under control and manage the symptoms, often for many years. The cornerstone of this treatment is hormone therapy. So we've mentioned that a few times. Hormone therapy is basically a therapy which lowers or blocks your male hormone, which is testosterone. And the reason this is so important in prostate cancer is that prostate cancer feeds and grows using the male hormone. So we can kind of starve the cancer and put it into remission using hormone therapy. And if you combine it with radiotherapy, it also makes the radiotherapy more effective. And some people eventually will also be doing what we call palliative treatment, which is all about symptom control, but can also sometimes be called end-of-life care. But as I said to you, with advanced prostate cancer, our treatments are often something that we use for a number of years. So often I think there's a big team of people, what we call the MDT or multidisciplinary team, that are involved in your care. Some of them you'll meet, some of them you won't meet, but they're incredibly important for your care. So you'll always certainly meet your urologist, which is a neurologist is a surgeon, and also often involved in the sort of diagnostic part of your pathway. You'll meet an oncologist. An oncologist is a doctor that treats specifically cancer, but non-surgically. So they are the doctors that do radiotherapy and chemotherapy. But you'll also meet your clinical nurse specialist, and we are people that support you through your whole journey. So we'll be there at diagnosis, we'll be there helping you make your decision, and often we'll be following you up after your treatment as well, and we'll certainly be helping you manage your side effects. But behind the scenes, you've also got radiologists who are specialists that interpret your scans and advise us on treatments, and your pathologist is the doctor that looks at your biopsy and again advises us on the nature of the cancer. So all these people are there working with us and with you to make sure that you get the best treatment. So now I'm going to talk to you a little bit about how to make good treatment decisions. And I think, again, it's important to stop for a moment and really acknowledge that treatment decisions can be very overwhelming. I think in lots of healthcare, or even in lots of cancers, there's very clear courses of action. If you've got condition A, we've got treatment B to treat it. And often it's just a matter of will I, won't I. But in prostate cancer, there is often a number of options, including do nothing. And it's really, really important that you are provided with the space and the right information to make the right decision for you. We use a principle called shared decision making. And if you're interested, there's some really lovely information on the internet about that, a lot of it through the NHS website. But it's based on the probably fairly obvious principle that for most of us, we want information about our options and we want a say in the decisions and how we're going to be treated. And shared decision making really is about where you're encouraged to discuss your treatment options with your healthcare team, but also really importantly, you're encouraged to share what's important to you, where you're coming from, where you are at the moment, and what things are going to be really important for you to make your decisions. And it's not just you. None of us come into these things, as an island. We want to also make sure that you've got the opportunity to include other people that might be supporting you. It might be partners, children, friends, support groups, etc. And also charities, because it's really important that you get all the support you need, and we're not your only source of support. And shared decision making helps you understand the potential benefits, harms, and uncertainties of different treatments. And uncertainty is really important. We don't know everything. And it helps you decide which treatments you're most comfortable with. This may be something that comes from the gut, or it may be something you work through. And it's about giving you a say in your own healthcare. So I talked to you about your healthcare team, but your healthcare team, we're experts in treatments, and we might be experts in prostate cancer, but we're not experts in you. You're the expert in you. So your healthcare team absolutely involves you as the centre of it, because only you know what you want, only you know what you don't want, and only you know what is acceptable and what risks you're prepared to take. We can't know that for you. So the Infopool I mentioned really quickly, but this is a resource that's being launched in January of next year. And it's a website really based on empowering people to make good and better informed treatment decisions. And it's going to give you lots of really easy to understand information. It's not a replacement for your healthcare team, but it's very much a contribution to your decision-making process. So we really, really advise you or recommend that you look at this as a really great source of information. And obviously, take those questions and things back to your healthcare providers and discuss it with them. And most importantly, in the Infopool, it's going to contain real patient stories. And it's so powerful to hear from people that have been there. As a woman, I haven't got a prostate. So, I might have, 15, 20 years of experience looking after men with prostate cancer, but there is nothing more powerful than listening to someone that's been there themselves. And you can learn from what other people have done in similar situations and learn from some of the decisions they've made and how they feel about them. So now I'm going to hand over to Sue Smith, and she's going to talk to us about the psychological impact of receiving a cancer diagnosis.
Thank you. Welcome, everybody. And thank you, Louisa, for your conversation. It's really great to be able to join you today. And I'm just to let you know my talk, I'm going to ask someone to move each slide for me as I talk with you. And I hope it's helpful, and I hope you're able to take something away from today. So my name's Sue, and currently I'm working as consultant clinical psychologist for Guy's and St Thomas's, and I've worked in cancer and palliative care now for almost 14 years. Next slide, please. So I just want to let you know a bit of the focus for today. So I'm just going to give you a little taster really about understanding what our threat response to a cancer diagnosis might be and to the treatments, what to watch out for when we might get stuck or feeling overwhelmed, and what might be able to help. Thank you. Next slide. I guess one of the things that I think is really important when someone first receives a cancer diagnosis, and you yourselves have, is that you're not arriving a blank page. I think sometimes we can experience entering into a medical system that suddenly we're talked about as a patient. We suddenly lose our identity, but actually it's really important to bear in mind that you're not just a patient. You're someone that's coming with your own family, social and cultural stories about how you might respond to illness and health and an adverse situation. And many different things are going to inform that. Also, I think as men and women actually with a cancer diagnosis, the way how difficult situations are talked about are also going to be shown and portrayed socially and culturally. For example, in music, films, books, men, you know, how are men portrayed in terms of dealing with difficult situations, parents, colleagues, and so on. So I think that I just want to let you know that it's really important to bear that in mind, because sometimes I think it can get lost. So you're important, you're more than just a patient, you're more than just someone with a cancer diagnosis, and you haven't lost that. It may feel like it, but actually you are coming into the cancer diagnosis and treatment with some of those things too. So next slide, please. Louisa in her talk mentioned this, but I think one of the way I understand her is that cancer does represent a threat probably to you, and has done, maybe to you and to others in your life who are important. And I think that in my experience of working with people, it's because it really connects with mortality and what it means to live, and the fact that our life on this planet ends at some point. And I think that sometimes we can live not really bearing that in mind. And I think a cancer diagnosis can really bring that into mind. Even if you've got a cancer that you're going to live with and it's going to be cured, I think it can still be very present for everyone. And I think also, as Louisa talked about, you know, there's lots of different treatments, aren't there, and regimes. You're going to also have to possibly live with some treatment effects. And if you're not having treatment, live with this idea that there's cancer in me. And making sense of that. As Louisa said, there's many decisions, many appointments. So I think that what comes to my mind is this changing physical health context for you. So this changing body, I'm aware of my body, this changing self, and perhaps it also has an impact on relationships too. I like to think about it as imagining your world in a snow globe, and someone's come and they've shaken that whole world up. And it can feel that you're in this snowstorm to begin with, trying to navigate what this new world's going to be like for you. So next slide, please. So I think that, as we said, it's likely that it's going to represent some sort of threat to you, and that humans are going to respond to a threat in a particular way. And I think that what's important for me is that it's there for a good reason. Every human being responds to something that's a threat to them, probably in a very similar way. And that is that your thinking brain is going to close down, even if that's temporarily and very quickly. And actually the 5 senses are going to be much more present. So I always think about this like the Incredible Hulk. Now, I'm of a generation that I used to watch Incredible Hulk in the 70s and 80s. And really, what it is that this adrenaline and cortisol-based response that's really preparing you for some sort of action. So it's really linked to the 5 senses. And it's there, and it's important, because as humans, without it, we would not survive, we wouldn't thrive. So it's really important to us when we experience these things. It's not because we're mad or because we're bad, it's because actually they're a way to help us survive and thrive. You don't want to be thinking if something's about to hit you, because by the time you thought, you'd be flat. So when we're getting difficult information or receiving it, or even if we're going for a scan result, whatever it is, it's likely that that system is going to be activated. And you probably know it more as related to the freeze, fight and flight response. So it's very closely associated with cortisol and adrenaline. It's going to link very closely to your muscles. It's going to dilate your pupils. It's going to make your heart beat quicker. And that's so that you're alert and aware and aroused. And it's why when people are first diagnosed or in situations that can be difficult, for example, receiving scan results, that you might not remember what you're told because your thinking brain isn't switched on. It's not because you're mad or because you're losing your ability to remember or recall. It's because this is what your body's doing and your mind's doing. So next slide, please. So I think that for me, it's really important to remember that this cycle is probably going to carry on throughout your cancer treatment, because you're going to have different experiences that may trigger the threat again. So initially you might be very shocked and threatened, and it's very destabilizing. There's this kind of human response, you know, this is happening to me. And remember also, it's going to probably also be happening to those people in your life too. They're not going to be immune from it. It's for you as the person with the cancer, but also for the people in your life too, because they're human beings too, right? And you matter to them. So the uncertainty, as Louisa said, is going to be there. It will not be okay. That might be in mind. New treatments, change of treatments, unknown responses might also trigger this, which takes you back to this is happening. And actually it's inescapable. I can't escape this. It's happening to me, which might link then back to certain shock, threat and a destabilizing. So just wanted to introduce this cycle, as I think it's a very familiar and common one. So next slide, please. Louisa talked a lot about decision making, and I do think it obviously it's a very core and key and important part in a cancer experience. And I just thought I'd put this slide in. There's lots more literature around this, but and actually I don't like the word failure, but actually I think what's really important to be aware of, that if you're already under threat, you might then pay more attention to threat-related information, and you might also interpret information that's actually uncertain or ambiguous in a more negative way, which might link to a more unhelpful solution for you in relation to your life. And I think that links to some of the things that Louisa talked about, but also I think what's really important is that what you're experiencing personally in terms of your human mind, the threat response might be there. You're not going to be able to turn it on or off, but you might be able to respond to it and be aware of it in a different way, so it can help inform decision making for you and whoever's in your life in a different way. What we also know is that when there's threat around, people might behave more rigidly, and you might neglect trade-offs. And what we mean by that is that you might not take time to think about costs and benefits in relation to things that matter to you in terms of your life, because the decision has such an emotional burden. So for example, what Louisa said, you know, I've got cancer, I just want it out. It might be a very automatic response that makes sense in relation to having this threat response, but actually helping it settle, knowing how you want to be with threat, to then think and consider a decision can be extremely helpful. So next slide, please. Louisa also talked about Infopol here, which sounds like a really great resource for people, because one of the things that I know in my work and job is that decisions aid can actually be really helpful to help structure decision making and information for you or people who are involved in your life with you. And what we know is that that is going to help improve your knowledge of options available. It means that you can become informed and clear about what matters most to you, and maybe also who else is in your life. It can also mean that you're getting information that's accurate about benefits and harms. Also, it's going to help you participate in your healthcare. And we do know there's quite a lot of research from, for example, the King's Fund on this, that shows the more you're involved in your healthcare, the better outcomes you have. And also these sorts of decision aids, or taking a step back, can really improve your communication with your healthcare professionals, because it's creating a dialogue with them. So next slide, please. So I wanted to move now just to summarise a little bit that at diagnosis, I think we can all agree it can feel very overwhelming. And also it's really reasonable to feel scared and upset, I think, that perhaps the threat of death is present, even though it might not be immediate or might not be happening to you. It is kind of there, and it might link to experiences you and your families have had in the past, because we all have experiences of people dying in our lives, right? So that it's going to connect in some way. But what we also know is that most people will settle and stabilise as treatment proceeds. So next slide, please. And the reason for this is because it's really normal to adjust to situations that are perhaps unexpected, or so for example, you know, the bus timetables changed. We're all living this week in a rail strike, pretty unexpected, but we've all probably adjusted to it in some way. I know I have today. You know, things like Brexit going into lockdown involved multiple adjustments for us, not only individually, but relationally and in particular groups we're in. And it connects with, well, what does this mean for me? What does this change mean for me? What does it mean in relation to people who are in my life, and how am I going to navigate this change? So I guess I'm emphasising here that it's very normal, and the transition is very normal, and the feelings associated with it are also very normal and to be expected. So next slide, please. I just wanted to take us now to the end of treatment. Obviously, there's a big sandwich in between, and I don't want you to feel that I've neglected that. I hope it's clear that from the cycle I introduced earlier, that the threat kind of like stabilizing cycle is going to kind of carry on through your journey and your experience of cancer. And then we get to the end of treatment. For some people, there won't be an end. But I guess I bring this in with people because I think people can be really surprised at the end of treatment, because people kind of think, I thought I was going to be okay. And actually, you may feel far from that. And again, this is a really common experience for people to have. Because if you look at that threat model, this adrenaline and cortisol has probably kept you going in some way. And it might be that at the end you feel relief, but now you're on your own. You might start noticing that now I've got time, I'm beginning to notice my body more. I might be noticing that I'm fearful of cancer coming back, or progression might be present. And some of these experiences might be reinforced by annual checkups or the medication you're taking. I also think, in relation to the people I've seen and worked with and heard and listened to, that loss and mourning is a really big part of end of treatment. Lots of people feel, I'm going to go back to me again, or how I was. But actually, I think that's almost an impossibility. Some things will be lost, some things will stay the same, and some things are going to be new for you. And I think for me, there's something about being able to hold on and understand what you've lost, to be able to create and rebuild hope together, and also to make sense for yourself individually. It's really important, because I think without that, it might be harder to kind of reconnect and build your life, because there's likely to be changes in appearance or physical functions. There might be changes in fertility, sexuality, endurance, and things like that. It's very common across all cancer experiences. Also, you might be much more aware of mortality. Am I lucky or vulnerable? So I just wanted you to be aware of that, so that there may be ways that you can parachute yourself towards the end to help know how you might want to do your ending. So next slide, please. So I guess just to summarize, there are many different ways of dealing with the cancer experience. There's not one way. So there's the behaviours we might see, both within ourselves, in others, and in wider society and culture. And there also might be more private behaviours, like internally, I'm going to put my head in the sand, I'm thinking about it, or just think positive, or pulling together. And so I just wanted to share this with you. There's not one right way of doing it, but there might be some ways that mean we get into more problems. So next slide, please. And so segueing in from that, I think one of the things about cancer is that it may make us more aware of our bodies, when we kind of sometimes take for granted, yeah? So sometimes suddenly I'm aware of my body. So I guess the reason why my professions are here, and in terms of human beings, trying to, like an experience of cancer, is connecting the head with the body to integrate it and see it as a whole. So thoughts and emotions make us human. And cancer and the experience of cancer treatment is likely to impact on both of these as we try and make sense. thoughts and emotions are a normal part of a cancer diagnosis. So next slide, please. I'm getting into a bit of the psychology bit here, but I find this model really helpful, and it's from someone called Paul Gilbert, who's written loads about compassion in psychology and also the evolution of psychology. But basically he talks about these modes that we all have and share. And they're the modes that basically have helped us survive and thrive as human beings. So not only in terms of individually, but also in relation to our bonds with one another. Because without our bonds with one another, we wouldn't survive as human beings. So the three modes are the threat mode, which links to the earlier diagram I talked about in relation to when there's danger or an event that really need, it might be a deadline at work, it might be something like cancer, yeah? And that threat mode really helps us drive. It's really useful, really, really useful. We wouldn't get loads of things done as human beings if we did not have this threat mode. And the drive mode helps us move towards these things. So it's very goal orientated. It helps motivate us towards doing the things that we need to do. And the soothing mode, there's lots in the literature to show how important this is. And this is about us taking care of one another, of someone else, myself. It's about understanding when something sad or scary is happening. I might need a hug, I may need to hold, I might need to do something to soothe and regulate. So what's important about the system is it needs to be a system that's in balance and regulated. Very often in modern Western society, the modes that we're mostly in are in the red and blue modes, and we do less of the soothing mode. And in a cancer experience, the threat drive mode might also be much more activated. And over time, that means we might crash and burn. So next slide, please. So when we're in threat drive mode, and some of us are might be really familiar with this. So if you think of things like work or, obsessing on one thing, it can we really only rely on one tool? So when we're going through something, if you think of threat drive, if we've only got one drop-down menu, only one option to go to, over time, this may take loads of energy. It may not work. It leads to self-criticism or stopping us from doing the things that matter to us or enjoying things, may stop us from asking help, may make us feel we're not coping, and it can make emotions scarier. So what I mean is the threat drive mode might also mean that when we're in threat, we want to get away from it. And so we might drive more to get away from it, but it's impossible. And you know why? Because human beings have emotion. There's not good or bad emotion, they're just there. But if you try and spend lots of energy getting rid of it, it might make us more overwhelmed, or it might mean that we want to give up. So next slide, please. I'm not going to go too much into this slide, but I wanted to just highlight when we might get stuck. So it's really important to acknowledge relationships that we're in, because they are times when we might get stuck. Some cancer experiences might link to past trauma and losses that we've had that we've not dealt with before. But the reason for that is because psychologically, emotional experiences match and map onto others that we've had in our lives. And we can access memories that we've had maybe years ago, might be very accessed and triggered in the here and now, if that makes sense. So it's great, yes, isn't it, relationally, having lots of people involved, but also it can create tensions between family members, people that are involved in your life, but also maybe and perhaps between medical teams. Relationally, you might find that different people become really overoccupied with the cancer or avoid it completely. But you yourself also might find that there are tensions between the beliefs that you have and the people in your lives, or faith or culture, whatever that might be. We also know the more socially isolated you are, you might experience getting stuck, and if there's tensions and conflicts in relationships. The individual factors I've alluded to really in relation to what I shared with you earlier, But it might be that a symptom suddenly becomes a problem. You know what, I've been doing fine, and suddenly there's this one last thing, and it's a straw that broke the camel's back. We also know psychologically that if you try and push away negative emotion, it's like pushing a beach ball underwater. It's just going to pop back and overwhelm you. And who's in control then? We also know that if cancer is too much center stage in your life, you're likely to get stuck. And also, if you blame yourself with this high degrees of shame around having a cancer diagnosis, that's likely to create difficulties for you. Likewise, if you're overly positive and put all your eggs in one basket, we kind of know that that can lead to poorer outcomes. And of course, linked to this, your life's going to carry on. Yeah, because you're still living. You're not just a patient. So you might be experiencing divorces, death, births, moving house, and so on as well. So next slide, please. So just really quickly, on your own, it might be really helpful for you to just take note of which mode you might have relied on so far to cope with your cancer experience. Which one might need some attention? And really, I think the aim here is to think about reducing your red, or perhaps how you want to be with the threat in a different way if you're doing too much of being in there, how you want to build blue in a way that's helpful and meaningful for you, and how you want to grow your green. So I hope that that's helped you just think a little bit about yourself, or perhaps people in your life, because they might be experiencing this too, to think about what might need some attention. So next slide, please. I think Louisa talked about this and said, you know, what's really important, and I've seen many people and family members and partners as well, and friends who are living with cancer. And I think it's really important to take time to think about how you're making sense of this cancer, the beliefs and meanings it holds for you and in your relationships to others. When there's lots of threat around, it's really important to go into that soothing mode, to pause, slow down, particularly when there are important decisions to make. And by that, we're meaning, you know, what's of value to you? Have your values changed? What's meaningful for you to live well? Because the reason you're going to have some of the cancer treatments is because you value your life. So really understanding that and what is important to you and who is really important, I think. Also, it's going to help, slowing down will help you foster curiosity. If you remember earlier what I said about anxiety in relation to making decisions, it can make us very rigid. So if you notice yourself becoming rigid, understand the threat, breathe into it to help yourself become a bit more curious, particularly with this strong emotion. It's going to be there. You're not going to be able to turn it on or off. It's impossible, believe me. So, okay, there's strong feelings here. What does it mean to me? What's it telling me? How do you balance knowing with not knowing is going to be really important. And when things can't be changed, focus on feelings and what matters to you. And I think there's something here for me about being with rather than avoiding that which cannot be changed. You can't change having a cancer diagnosis. It's impossible. So focus on the things that you have control over rather than things that you don't, and that will make a real difference to you. So next slide, please. I've put this slide in about seeking help because there's lots in the literature about this, and also in relation to kind of men and some women actually, that I really wanted to reiterate that seeking help and offering help is a really normal part of being a human being, and without it, our groups would not survive at all. And some of the messages we might receive can label help seeking and make it really difficult. So if you think of messages like staying strong, it's weak if I need help. And there might be things that connect with you right now in your own experiences of men growing up or in your own families, or the messages you heard from your own fathers and mothers and people who are in your own groups about this. So next slide, please. I'm putting this in because I'm really passionate about it. And I really think that there's something really neglected about men and healthcare. And I think it's really important as men yourselves, and you're going to know men, you might have your own sons, you might have grandsons, colleagues at work. But I think it's really important to know that men tend to have lower levels of health literacy than women, less likely to use general practice or visit pharmacies. And perhaps men are less likely than women to acknowledge illness or to seek help when sick, because it might be constructed as a feminine concern. And I've put a link here that might be useful for you, for men in relation to accessing information around health. And obviously that's just, you might have very different experiences than this. I just wanted to put in there because I think there is something neglected around this. In our service, for example, we have 1 man to every 3 women accessing our service, and that's not right. There's something going on there that I don't think is healthy or good for us culturally or socially. So next slide, please. So you're here now, yeah? You're here, you've come, you've been committed, you've come to this webinar. So well done, because I think it's not easy. You could have been doing lots of other things right now, and you're not. You're here, you're listening to me. Well, you might not be, but I hope you're listening to a bit of what I said. And ask yourself, you know, who can you ask for support in your life? What would you want them to know about? What would you want to talk to them about? For some of you, it might be about the cancer, but for others, it might be other things. You know, you're not just someone with a cancer diagnosis, and you're not just someone who's a patient. Also ask yourself what might get in the way of you seeking help and communicating to others about how you feel and what you might need. Often that can be really neglected. And how might you manage this? So that's just me leaving you with a few questions there. So next slide, please. So perhaps you can identify 2 things you've learned from my talk today, and maybe Louisa's as well. And identify 2 places where you might ask for help from if needed. And I've come to the end of my talk today. Really like to thank you for listening to me and taking the time out of what must be a very busy schedule you have right now. So something matters to you for coming here right now. So thank you very much.